questions and concerns right now is it safe for my children to return to sports during the pandemic? This is a great question. There are many elements unknown at this time, and it's an ever-changing and rapidly changing situation that we find ourselves in. It's not a one-size-fits-all answer. We all just need to work together to figure this out, but there are certain specific and personal factors that need to be considered when making this very important decision on whether it is the right time to return your children to the sport. We know activities and athletics are very essential to the physical and mental health of our students and our children, and during this time, it's even more crucial, as we've seen recent studies have shown an increase in some mental health situations with being depressed as our students are not able to participate as they did prior to the pandemic. There are risks and benefits that are inherent to participating in sports even before the pandemic. Certainly adding the COVID-19 situation has increased certain risks that you need to be educated and make informed decisions on. Some of the benefits of participating in sports are the improved health, mental, and physical well-being of individuals. We see that students that participate in activities and sports have better grades, they have a higher self-esteem, they have more confidence, more leadership, they are more likely to graduate from school, and they're at a higher percentage to also attend college. Certainly, those benefits make us want to push further to participate in the sports. Participation normally, like I said, poses an inherent risk for the sports. There are common injuries and illnesses associated with them. However, additional concerns are present as we navigate through the COVID-19 pandemic. Some of the risks that are involved are that most individuals have been without athletics or activities for at least the last 4 months as they've navigated through the hunker down or the stay and put mandates that their respective states have caused them to have to endure. With this, there is an increase in a deconditioned and a non-acclimated athlete individual. So we need to make sure that we're not jumping right into the levels that they were pre-COVID, and we have a phase by phase or an individual progression to make sure that it is safe for our students to enter back into the sport. There needs to be a safe and appropriate progression, taking into account these deconditioned athletes at different levels, and also the acclimation with different elements of the environment and the settings. Participation also will increase contacts that your children will come across with, and that may increase the exposure, which will increase the risk of potentially contracting the virus. The top 5 things parents should consider as they decide when to allow their children to return to sports. Number 1, does my child have any pre-existing conditions which may put them at a higher risk for severe illness from COVID-19? Adults and children who may be at a higher risk for severe illness due to the COVID-19 may have high blood pressure, diabetes, asthma, heart conditions, and/or a compromised immune system. We need to take into account the specific underlying health conditions and concerns when making the educated decision on whether or not to return our children to sports during this time, in addition to the members of the household, if they have any high risk situations, making this a higher risk for our students to maybe bring a element of the disease back home. So in addition, we need to look at the high risk nature of our students in addition to the home situation. Is your area a hotspot for the virus? This is an important factor to consider. We know that day to day, different hotspots do occur. Some states, some individual cities, counties, or regions seem to have a higher incidence and then calm down, and then there is always a chance of another outbreak. So how do we know, or how do you know if your area is a hotspot? I encourage you to look at your state and your local health officials, as well as utilizing your athletic trainer. These individuals can help with up-to-date information on outbreaks and or on safe progression from one phase to another phase for different activities. Each team, though, needs to make quick adjustments and to meet the specific and unique demands of new developments in that region, county, or state. So when thinking about joining a sports team, know that there is going to be a high degree of flexibility and be able to have to adjust at a short moment. Number 3, does my child's school or team have a plan in place to minimize the risk? This is a great question to look as we look into whether or not it is right for our children to participate in the sport. Are there daily pre-workout or pre-practice screenings that will be taking place? These include measurements to ensure that if a student is not feeling well, that they remain at home. This also ensures that the day of the practice or the contest that they are exhibiting no signs or symptom of the virus, and that they have a temperature within the normal degrees. Additional considerations include, can the team social distance appropriately when they are not actually participating in the sport? Examples of this would be on the sideline. Can they space out enough to where they're not having that physical distance concern? On a bench, could they put an extra chair so they can spread out there? Can a team actually do that? The amount of shared equipment, can we minimize shared equipment? Can each individual bring their own ball or clothing equipment that they need? We definitely want them to bring their own water bottles. We do not want them to be sharing from a sole area at this time. What is the size of the team? We may need to break up components of the team into smaller groups and maintain that small group throughout a certain phase of re-entry into the sports. What is the length of time that they're going to practice? Can we minimize? We know that the more close contact our children have, the higher degree of risk. So we may need to stagger some time so we don't have a lot of crossover of entering and exiting students. We may need to minimize any visitors or spectators that are there, but what is the length of time that they may be on at the venue at each time? Is the event indoors or outdoors? Indoors has an additional consideration of being a little bit more close-knit, whereas outdoors there is more room to expand. So that would be another consideration. What is the availability of supplies to promote proper hygiene and sanitizing the equipment? Are we going to be able to have those plentiful and available for our students to wash their hands prior to the event, during the event, and after the event? Are we going to have these supplies available to wash equipment periodically through the event, and certainly before and after the event? Does the team promote positive behaviors? Are we promoting social and physical distancing when we can at the practice or at the event? Are we promoting proper hand hygiene, washing our hands periodically, soap and water for at least 20 seconds? In the event that that's not available, using hand sanitizers. Are we also promoting cloth coverings or masks of the face? Certainly high intense activity. We don't want to compromise airway or cause additional health risks. However, certain face coverings can be used for safely for certain components of the sport, certainly with individual drills, maybe some warm-ups, and definitely during some of the team meetings, if you are not, or if your student is not participating at that time and they're sitting on the bench or on the sideline, they can wear the face covering. I've heard of a lot of teams that are incorporating buffs, and when the individual teams are meeting or they are on the sidelines, they put the buff over their nose and their mouth, and when they are running their sprints, they just pull it down on their neck. And I think that's a great area to where you're not having to bring a mask and try to find that. But that's one avenue. And are there posted signs saying that there is a policy? Sometimes visually seeing the policies and procedures that the team is abiding by helps with continuity and helps with everybody just buying into it and promoting it. Number 4, is the sport my child wishes to participate considered a high risk? In order to best figure out the risk of the sport, you need to consider a few factors. Some of these include the physical closeness of the individual, the physical closeness of the individuals, the length of contact the individuals may have with each other. Is there shared equipment? And is this shared equipment something that we can clean in between use? Or is this going to be equipment that is going to bounce back and forth and we rely on cleaning it sporadically through maybe timeouts or half times, things of that nature? Is there social distance opportunities? Can we make something a bit safer by spreading out those that aren't participating at that time? Can we add space for huddles or not do handshakes and not do high fives? Can we limit those contacts that have been a source of the sport or the activity for a long time and become behaviors, but can we minimize that to also decrease the risk of additional contacts? Is there lack of protective barriers? Some sports may have face shields or may have a distance where it is a lot safer than some of the sports that require physical contact between the participants for a long length of time without any protective barriers. And what is the risk, or what is the percentage of transmission of respiration particles throughout the air? A lot of heavy, high intense, close proximity sports will have a higher risk due to the projection of the respiration droplets transferring from participant to participant. We know that the more physical and the longer the physical contact between individuals, the higher the risk. So when looking for, is a sport that my child wishes to participate a higher risk sport, you need to look at the physical contact, the length of the contact, and is there any protective barriers or measures for that social distance? Even with high-risk sports, there are certain measures that we can navigate through so we don't have to eliminate that possibility, one of which could be working on individual skills during a certain period of time and honing in on that in a safe proximity from the other people. Number 5, does my child's team have an athletic trainer? Athletic trainers are highly qualified, multi-skilled healthcare professionals. They're trained and educated in prevention, clinical diagnosis, emergency care, and rehabilitation. Having an athletic trainer as part of the team is vital and essential, especially during this time. They serve as a trusted source of information, and they are a fantastic resource for parents, students, coaches, teams, admin, and the community members, and will be up to date on the current protocols and best practices as we all navigate through this COVID-19 pandemic. Parents need to make an informed decision and do what's best for their families and their individual situation. Athletic trainers are a trusted source of medical information and can answer questions and concerns and further discuss specifically what you need to know prior to the decision, the important decision on allowing your child to participate in a sport or activity due to the COVID-19 pandemic. I encourage you to contact and team up with your team's athletic trainer to discuss further your questions and to help us navigate or help you navigate through this unprecedented time.